Hi there, this is Mark Ittleman, speech-language pathologist, and welcome to the Teaching of Talking 2.0, where we share with you a number of videos that we believe are very, very important for you to understand. You know, there's not a whole lot of really good information for caregivers out there that's easily accessed and easily digestible. So that's why we're providing these videos for people who are caregivers and those with aphasia. And this particular message is about aphasia and maintaining communication. And you're saying, what, maintaining communication? Yeah, maintaining communication. And then you might want to ask, well, who should I maintain communication with? Well, I believe that each person with aphasia and each care person of or loved one of the person with aphasia needs to be able to have a person to communicate with, especially if that person is a speech-language pathologist or an expert in aphasia. Quite often, people are seen for aphasia therapy, and they're seen by their speech and language pathologists or their aphasiologists or their speech therapists. And then there comes a time when people are discharged from ongoing treatment. And what happens is that they're out there at home, they're out there in what I would call like an abyss. It's an area where there's very limited communication. And if a person has had aphasia, or if you have aphasia, you need to stay in touch with somebody so that you can get advice, you can report any particular changes that are going on with you. So just know that as a person lives their life after an onset of aphasia, speech may change from time to time. One of the things that quite often changes after an episode of aphasia is the clarity of speech may change. In other words, the speech may become less distinct. And so a person with aphasia and their loved one need to know that if something like that happens, you want to be able to stay in touch with not only your neurologist or the physician who is managing you, but also the speech pathologist, because the speech pathologist has a great deal of information, knowledge, and expertise about speaking. And speech does change from time to time, so you'll want to be in touch with a speech pathologist should your speech change. And not only does the articulation or the clarity of speech change, but sometimes the recall can change. Sometimes an individual with aphasia, they might have increased difficulty recalling words or increased difficulty constructing sentences. Now, if that happens, and it happens over time, then again, that's another thing you want to be able to do. You want to check with your doctor or your neurologist and talk with a speech-language pathologist, because the speech-language pathologist is an expert when it comes to speaking. And that person knows more than just about anyone. So don't bother, if you have a question about speech and you've talked to your doctor about it, go to the next best expert who knows speaking or who knows talking, and that's a speech-language pathologist, especially one who has training and expertise in aphasia. Another thing that happens over time is swallowing may change. Initially, some people with aphasia have swallowing difficulties, and sometimes they improve very nicely after onset, and sometimes they improve, and then a little bit later on, sometimes swallowing problems start to occur. Some people have difficulty swallowing thin liquids, or they start choking intermittently during a meal. This is a warning sign. And this is something that, again, you should check with not only your doctor, not only your neurologist, but also a speech-language pathologist, because the speech-language pathologist knows more about swallowing and swallowing difficulties, especially with those who've had aphasia. So if you've developed a cough, or if you've got a lot of congestion, or if you get watery eyes after you eat, or if you have intermittent coughing or choking episodes on thin liquids, please make sure that you consult with your doctor and the speech-language pathologist. The speech-language pathologist has had advanced training in swallowing difficulties, and the speech pathologist probably knows more about swallowing difficulties than just about anybody. Now, the other reason why you want to stay in communication with a speech pathologist is sometimes if you need a second opinion. Now, let's face it, all of us have been to doctors or we've had professional services that we haven't really always been that happy with. And so in the event that you've been followed by a speech-language pathologist, and if you still have questions, or if that person didn't necessarily treat your problem in the way that you thought it should have been treated, please make sure that you always get a second opinion. A second opinion is so very, very, very important, because I've heard lots of stories from people who've gone back to their doctors time after time after time with a particular problem, and the doctor has tried to treat it, and the problem doesn't seem to go away. Finally, the individual may go to somebody else, and that other physician or that other doctor or that other specialist may find something that may treat the problem and remediate the problem. So always make sure that you consider a second opinion. And that is if you're unhappy with the results, or if in some cases you don't understand why you're having speaking difficulties. Now, sometimes physicians and sometimes even speech pathologists don't spend the necessary time with the individual or the care partner to explain what's going on. And sometimes they could be in the complete quandary about knowing what to do. So if you have an aphasia, or if you have a loved one with an aphasia, and you don't quite understand what needs to be done, or if the problem is going to get any better, or if it's going to get any worse, or if you have any kind of question about it, remember that the physician, of course, is one of the people to see, but also the speech-language pathologist, because remember, no one, and I mean no one, no musical therapist, no physical therapist, no one else but a speech-language pathologist who's had training in aphasia and aphasia rehabilitation, no one else is going to have that information and have the expertise that you may need. So that if you're unhappy with the results, if you don't understand what's going on, and if you still want to improve and look for somebody who can help you, or if you want to improve your speaking and you just don't know what to do from this point, always reach out to a speech-language pathologist. So just remember that speech problems can change over time, and you need to have somebody who's familiar with your case, preferably that you can call upon from time to time if your condition changes, if your speech clarity changes, if your recall changes, or if anything else, if anything pertaining to your speaking, to your comprehension, anything, or if you don't understand anything, please make sure that you have a specialist not only your doctor, but a speech-language pathologist to call upon. And that's my message for today, which is called communication. Communicate. Communication is the name of the game. And this is about aphasia and maintaining communication with experts. Thank you very much. Have a great day, everybody. Oh, down below is our website, teachingoftalking.com. If you'd like to access our website, just go down below the video and click on teachingoftalking.com. If you want to speak with me about any particular concern that you have, please, there's another area to click where there's a questionnaire. And this questionnaire, I'd like you to fill out and just tell me a little bit about yourself and a little about any particular challenge that you may have or question that you may have, and send it along to me. I'll review it, and then if I think we're a good fit, or if I have an answer that I think I can give you, I'll contact you back and we can set up a phone call. So thank you very much, everybody. Let's make 2019, remember, the year for better speaking. Bye-bye now.